What if acupuncture, herbs, and even light itself can improve your chances of starting a family? Mike Berkley at the Berkeley Center in New York City has dedicated his career to answering that question. Next on DocStars.
Welcome to DocPod's DocStars.
Hello, everyone. I'm JJ, and welcome to DocStars on the DocPod channel. Today, we are joined by Mike Berkley, a licensed board-certified acupuncturist and herbalist and founder of the Berkeley Center for Reproductive Medicine in beautiful New York City. And of course, for more than 2 decades, Mike has specialized in fertility medicine and integrative reproductive care, combining acupuncture, herbal medicine, and low-level light therapy known as LLLT, which we're going to talk about today. He's used this to support patients through infertility struggles, now IVF journeys also, and reproductive health challenges. So today we're going to explore a couple of things. We like to detail exactly what we're going to talk about today. We're going to talk about why infertility remains one of the most emotionally draining and misunderstood medical journeys. Also, how acupuncture, herbal medicine, and LLLT provide holistic support for reproductive health. Also, we'll dig into what science and real-world patient stories reveal about interactive fertility care, and also where the future of fertility medicine is headed. So a lot to touch on today. Mike Berkley, welcome to DocStars. How you doing?
Thank you so much. It's a pleasure to be here. I'm well, thank you.
Well, this is great. You and I had a great call prior. We talked a lot about, what is going on in your field. And we wanted to bring you on today because I think you bring us a different approach, something that we haven't heard a lot about. It's not as mainstream, and maybe it's more mainstream than I think, but I think it's great to have you on the show. And I always want to know what the why is. So what led you personally into fertility medicine and integrative care? How did you get started?
Yeah, absolutely. So I was a computer salesman, and my wife and I had decided to try to have a baby. I think I was about 32 years old, and we tried for, I guess, about 6 months unsuccessfully. And she went to a gynecologist, not a reproductive endocrinologist, but the gynecologist did some testing, and he determined that she had anti-sperm antibodies, which means that her cervical mucus was attacking my sperm, and I had poor morphology, which means the shape of my sperm was not good enough to penetrate an egg. So she told me that she was going to go to an acupuncturist. And of course, I uttered, "How nonsensical can you be?" Um, she was going for treatment, and 3 months later, she tells me on the phone that she's pregnant. And I wasn't at all excited because I really didn't believe it. I said, "How do you know?" And she said, "Well, I peed on the stick and it shows that I'm pregnant." And I didn't know anything in those days. And I said, "Well, I don't know what that means. You peed on the stick. You have to go to a doctor and get a blood test." So she did. And the end of the story is my 30-year-old son just went out with his girlfriend. And so the acupuncture may or may not have helped her. Maybe she got pregnant without the acupuncture. Who knows? Um, and I say that with humility because I think that even in IVF cases, there are many situations where a patient will give up on IVF because they've done, multiple retrievals, transfers, and they just decide to forget about it, and they go to Hawaii for vacation, and she comes back pregnant. So maybe it was the acupuncture, maybe it wasn't, but I think something had to affect a change that led to a positive outcome. And then I was reading The Village Voice, which is an old-time New York City newspaper that's no longer extant, but it was back in the day, and it was on my desk. I never read this newspaper. I don't know how it got on my desk, but somebody was in my office, and they must have left it on my desk. And I'm flipping through the pages, and I see an ad from Pacific College of Oriental Medicine in California. I'm a New Yorker. And in the ad, it says, "Listen, we're opening in New York. We're having an open house." So I said, "Well, let me go and listen to these not so bright, not so intelligent, you know, individuals, and just check it out. And so I went, and what I witnessed was the most intelligent, well-spoken, articulate, knowledgeable people. And I got chills and I got excited and I was, man, like this is fantastic. And I decided to take one class just to see how I would do. And I left 6 years later. I did 4 years of acupuncture, graduated, into practice, and went back again for 2 years to do herbal medicine. And that was probably about 28 years ago. And here I am. And by the way, when I started, all my hair was black. And so it's been quite a journey for me. And here I am.
Amazing. It's an amazing story. Everybody comes through in different ways and they find their own journey, right? And obviously yours, we just heard it. Either way, you did find it there. And so one of the things that we try to do here on DocPod is really make sure that we state the problem, we find out what it is, we provide the solution, and then we give the evidence. And so that's why I was excited to kind of bring you on today to kind of dig deeper into what you just talked about, which is the beginning of your journey. So talking about the core problem in your experience over these years, and you've had a lot of it now, what do you think are the most common emotional and physiological tolls infertility takes on people? Because we do read about it, we hear about it, but from you, based on the evidence, what are your thoughts there?
Well, the evidence I'll present is evidence that I'm confronted with face to face on a daily basis, as opposed to citing studies. Infertility is, I mean, thank God I have no experience with cancer, but infertility is probably, almost at that level uh, of grief and fear and anxiety and trauma emotionally to the woman and the man, to the couple, or whoever it is, whoever the couple is. Um, and so it takes a devastating toll on people. It's a very hard journey, and people are very interesting in the world of fertility. Uh, People come with all different kinds of backgrounds. I'll just tell you a really interesting quick story. I had a patient. So I'm going to say something now, not to be political or anything or religious. I'm Jewish, and I had this patient who was Jewish, and she was a religious Jew, and I'm not. But it's pertinent to the story, this information. So she would come to my clinic twice a week for treatment, and she would always cry because she was so upset. She didn't think she was going to have a baby, and she's absolutely devastated. This woman, and during my conversations with her, I come to learn that she had five children, and I wanted to say to her, what's going on? I don't understand. And then she tells me, and this is a highly educated, like, serious woman. And she tells me that she's a religious Jew and she's Kabbalistic. She believes in the Kabbalah, which is a certain type of Jewish mysticism. And apparently in the Kabbalah, the number six is the number, like, you have to have six. You have to have six in your phone number. You have to live on the sixth floor. I mean, not literally, but six is an important number. And she had to have six children. So it's a very interesting story in that she, with five children, had so much grief because she couldn't get the sixth. And then you have women with no children that have so much grief because they can't have the first. So it's a difficult journey for all involved.
Yeah, 100%. And it's interesting because, I don't think, what you've been practicing for so many years. I lived in Shanghai, China for about 5 or 6 years, off and on. And so, yeah, 你好吗?我叫 JJ. And it was great though, because you're in this part of the world where, they know so much about this. You hear about it every day, and I see so much of it. But then I come back to, areas of the US and Europe and South America, and I don't see as much of it. So why do you think conventional treatments have left patients feeling more physically and emotionally spent? What gaps are you seeing, and what have you kind of had to deal with during your time that now you see, hey, listen, I see people moving into this area that we specialize in?
So the I suppose the physical dilemma of infertility vis-a-vis the journey to parenthood through in vitro fertilization is quite difficult. A woman has to take all kinds of medication. Sometimes she has to take medication that causes difficult side effects. She has to undergo a retrieval, which is no small order. It's not, you're under anesthesia, but it's an uncomfortable thing. It's kind of like a minor surgery in a way. So, and then of course, when women take, gonadotropins, medications to stimulate their follicular development, you know, there's danger there. It doesn't happen often, but you can have hyperstimulation, which means that, severe hyperstimulation is means you have to go to the hospital. You can even die. Now, this doesn't happen often, but these are the difficult things that manifest, or can manifest physically. There's the retrieval, there's taking the drugs, there's the potential of hyperstimulation, there's the potential of, getting two eggs out, which is not
Mm.
gonna work probably. There's the potential of getting 10 eggs and fertilizing the eggs and ending up with 4 embryos. And then you test them with pre-implantation genetic diagnosis for aneuploidy, meaning checking these eggs out, or rather the embryos, for chromosomal abnormalities and finding out they're all abnormal. And then you have to do it again, another retrieval, and take more medication. So those are some of the things that cause the physical challenges and the physical dilemma for the woman. The man, doesn't have to go through much. Well, sometimes he does. I shouldn't really say that, but generally, the woman goes through a lot more than the man. And of course, emotionally, as I stated, there's so much disappointment. You do an IVF cycle, you pay $25,000 if your insurance doesn't cover it, and it doesn't work, and you go through it 3 times and it doesn't work, and then you go through it 4 times and you get pregnant and you miscarry. Obviously, this is not to convey the message that IVF doesn't work. There have been multiple millions of babies born as a result of IVF, and I fully support it and embrace it and respect it and admire it. But nonetheless, it does present these kinds of problems potentially.
Yeah. Yeah. And it's interesting because we did have, Dr. Mark Trilis, who from Winter Park, Florida, on, and we were talking about that. I mean, it can be a roller coaster, right? Emotionally for people. You think you're there, it's not there, it doesn't work out. And whether, it's on the IVF that he's working with or the side that you're working with. So it's interesting to see that. So let's talk about trending integrative solutions, right? Given that acupuncture is increasingly popular, I read recently that close to 40% of people trying to conceive, they're using acupuncture potentially. So, what specific reproductive issues do you help address? I think that'll be interesting for us to hear today.
So I think the way I'd like to answer this question, if it's okay with you, is to talk about first what it can't fix, and then talk about the potential.
Perfect.
Yeah.
Yeah.
So this is great information for patients. And number one, acupuncture or herbal medicine cannot, nor can anything, increase ovarian reserve. So if a woman has low ovarian reserve, high FSH, low AMH, she's in diminished ovarian reserve state, or a state of diminished ovarian reserve, that is it. She's not getting any more eggs. There is a supplement that one can take that occasionally will give a woman some additional eggs, which is called dehydroepiandrosterone, known as DHEA, but it certainly, works a little bit if it works at all. So anyway, back to acupuncture and herbs, they cannot give you more eggs. They cannot give one more eggs. However, they can increase sperm count. But I'll stay with the woman for the time being. So what what I say to potential patients when I'm on the phone with them, they're asking me what can they expect as a result of the treatment. And the first thing I say is, well, either something or nothing, meaning that I don't know if I can help you. I don't know if you do 10 IVFs, if you can get help. But I will say that very frequently, for over a period of 2,500 years, acupuncture and herbal medicine has improved egg quality, has improved lining quality, and has improved sperm quality. And this is absolute 100%, no questions asked, fact. Um, so
Interesting.
that is the purpose and the utility of acupuncture and herbal medicine: improve egg quality, improve lining quality, and improve sperm quality. I also want to say that acupuncture and or herbs are very efficacious in helping uh, uh, to to um, to mitigate or reduce miscarriage occurrences. Now, again, to be very clear and very straightforward, if a woman has a chromosomally abnormal embryo, nothing's going to save it, nor would the woman want it to be saved. But there are many women who transfer euploidic embryos, meaning chromosomally normal embryos, and they still miscarry. And, there's dozens of reasons potentially for that. But certainly one big reason is something called hypoxia, which means that the yolk sac, which is the component that exists before the placenta is formed. There's this yolk sac that embraces the embryo. It's a mini placenta. It's a pre-placenta. And so it needs oxygen to feed the embryo. And later on, the placenta needs oxygen to feed the baby oxygen and nutrients. So there has to be, so what is hypoxia? It's a deficiency of oxygen. And so what acupuncture does is it improves hemodynamics. In English, that means it improves blood flow. And if you improve blood flow initially to the yolk sac and subsequently to the placenta, she may miscarry, but she's not going to miscarry due to hypoxia because the blood is filled with oxygen. And so acupuncture is, in essence, facilitating a delivery of a greater amount of oxygen than they would get without the acupuncture.
Okay, so that helps because I think it kind of helps frame all of this. So I'm glad you went in that direction. And even while I'm listening to you talk, I'm thinking to myself, so why do you think, before we go to other questions, because I have so much to ask about this, I think it's so interesting. Why do you think that people oppose it? I think that's I always try to look at that side of it. Why, if there's 40% that are maybe using or close to it and they're interested in it, why do you think the other 60% aren't? What's holding that back when you look at, integrated herbal medicine and low level light therapy, which we'll talk about, and acupuncture? What are your thoughts there?
So I'm not sure that oppose is the right
Hmm.
word. I think it's more that people either don't believe in it, they don't even know about it. They think acupuncture, yeah, it's for my back and neck pain. They just don't know about it. And so I don't say this in a pejorative manner. I say it in a literal manner. People are ignorant of the benefits of acupuncture and herbs in the context of fertility enhancement. And I think that when I started, fewer people who were trying to conceive were using acupuncture than is the case now. And I think as time goes on, more people will utilize this. And what I say to patients or prospective patients is, look, do what works. You're going to change your diet, aren't you? You're going to stop smoking cigarettes, right? You're going to stop smoking pot, right? You're going to stop drinking 2 martinis a night, right? You're going to start to exercise, right? So why not utilize something that may facilitate uh, or help you in your quest to become pregnant? We know that this works. It's been around for a long time. Why not try it? I'm not saying that it's gonna change anything, but it may. I'm not saying IVF is gonna change anything, but it may. So, people just don't know.
Yeah. No, I love it because I think that, and probably oppose wasn't a good word. So I'm glad you clarified that. Thank you. I think it's more, I just feel like you say people aren't interested in it. I don't know why the narrative isn't out there as much. Like you say, they just don't know, But I think what you're talking about, which I like, is that stay open to it. We're not sure, but at least be open to it because it could really help you. And so I think that's a great message, right?
100%. 100%. I mean, look, this is the most important thing I'm going to say here. There's no downside to using acupuncture herbal medicine. Neither can hurt a patient. Neither can negatively impact one's journey to family. Neither one of them can cause miscarriage. I suppose it can cause miscarriage if somebody has no idea what they're doing, but generally it's extraordinarily safe. It can either help or not. That is the binary presentation. So there's really no downside to it.
Which is amazing. I mean, if there's no downside and I'm a curious person, I'm all for it, right? And so that's why we want to bring you on the show today to make sure people hear that because I don't always know that's the message that we hear. And so having this discussion and having the dialogue and getting the information out there for me is like half the battle, right? Of making sure people know about what it is you guys do.
Yes, indeed. I agree. I think that, spreading this information, spreading the knowledge is important. And, believe me, I don't make the same money as reproductive endocrinologists, but I do what I do because it's the most gratifying work that I've ever done. I help people to overcome something that causes tremendous pain and grief and anguish in their lives. So, I do this because I love to help human beings. And I think that if it was nonsense and it didn't work, I'd have quit in 2 seconds and gone into business, which I was in before I became an acupuncturist, and I was good at business, and I would have no problem in a second leaving this if I thought it was nonsense. But in fact, it's not.
Yeah, well, it's a great mission to have, number one. So, congrats to you. And let's talk a little bit about how you integrate these other two areas when I'm doing my research and trying to figure out, herbal medicine, low level light therapy. How are you integrating those into the mix and what does that look like? Because I do think that's an interesting side as well.
Yeah, great question. So when a woman is undergoing IVF, if you have four women, one has polycystic ovarian syndrome and she's morbidly obese, and one has polycystic ovarian syndrome and she's normomorphic, she has a normal regular body, and one patient has a history of endometriosis, and another patient is idiopathic. She's 34 years old, the husband's 34 years old, and they don't know why she's not getting pregnant. So when those 4 or 5 patients go to an IVF clinic, they're all probably going to get treated differently. They're going to get treated according to what they present. So the PCOS patient that's obese is going to get treated differently than the PCOS patient who is not. The patient with a history of endometriosis is going to get treated differently than one without. And so acupuncture and herbs are kind of like prescription-based modalities of intervention as well, meaning that we're in the same boat. If I have a PCOS patient that's morbidly obese and I have a PCOS patient that's normomorphic, they're going to get a different acupuncture prescription. Which acupuncture points am I going to use? And it's the same for herbs. Now, herbal medicine is a whole different bag, a whole different bag. Let me say this, that any acupuncturist who has no idea what they're doing uh, can stick needles in you and, read a couple of chapters out of a book and, say that they're treating you properly. And of course, they have no idea what they're doing. And this is another big problem. The patient doesn't know that they have no idea what they're doing.
Mm.
The acupuncturist doesn't think that they have no idea what they're doing. They think that they know what they're doing. But that's the acupuncture side. But on the herbal medicine side, and this is really quite disturbing to me. I've seen this over the years in multitudinous occasions where people will become board certified in acupuncture. I'm sorry, in herbal medicine, and a patient comes in and they will prescribe these herbs. And what are these herbs? It's a bottle of pills that have a name on it. Maybe it'll be Xiaoyao
Mm.
or Guipitom or something. It'll have the name of the formula and they'll give it to the patient. This is not Absolutely not herbal medicine. Herbal medicine is when you sit down with the patient's chart and you look at your intake and you look at your notes and you say, this patient had a laparoscopy 15 years ago for endometriosis. She, to this day, has pain on intercourse. When she's menstruating, she has pain during defecation. She has severe low back pain right above her tush. This woman has the endometriosis has continued. She still has it. So obviously I'm going to tell the patient, not that I need to instruct her doctor, but I'm going to say to the patient, in my opinion, you should be on 3 months of Lupron and low dose naltrexone to suppress the endo and alleviate inflammation. But from an herbal medicine perspective, I'm going to literally sit down with a pen and paper and write down the herbs on a piece of paper with the dosages. In the herbal formula, there's going to be inflammatory reducing potential or qualities of the formula. There's going to be one of the desired outcomes of that formula, for example, would be to stimulate blood flow, because in Chinese medicine speak, stagnation or stasis of energy in blood is what causes pain. And if you look at it in not such an esoteric way, it's really true. If you bang your leg on the corner of your desk and you get a big black and blue mark, what is that? What is it? Well, some people will say it's a bruise. Some people will say it's a hematoma. But what's going on in there? It's stuck blood. It's blood in there that's turning black, and that's why you get black and blue, and it hurts. So stagnation equals pain. It's really very simple. So in my formula, the formula is meant to reduce pain from the endometriosis patient, but also to help reduce inflammatory proteins that manifest or circulate in the uterine cavity, even though we all know that endometriosis is a disorder that takes place outside of the uterine cavity. Nonetheless, the uterus is bombarded with what's called pro-inflammatory cytokines. And it's like you need this oven to be 200 degrees to have the baby, but the oven's 600 degrees. And so you use herbs to help reduce the inflammatory proteins. So now there's another thing I'd like to add to this, with all possible humility, which is, why would you use herbs on an endometriosis patient to reduce inflammation if they're already using Lupron and low dose naltrexone? So that's a very good question. And I suppose the answer might be, well, listen, I've done 3 retrievals and 2 transfers and nothing's working. I'm 34 years old. My husband is 33. His sperm is good, but I'm not doing IVF anymore. I'm finished. I've spent $60,000 on this. I don't want to do it anymore. I just want to try naturally. And that's a reason then, therefore, to use herbs that will reduce inflammatory proteins, because she's never did, or she's no longer using Lupron or naltrexone.
Yeah. Yeah. I find it really interesting because when I'm listening to you, and a lot of times when I'm interviewing different healthcare leaders and doctors, what I hear is that it really depends on the person, right? The thing you talked about early on was, look, I looked at this patient's exact charts. I looked at everything she's doing, and I'm really customizing this 100% to this person, because it's not a one brush paints everything, right? You really have to look at case by case for each individual person. Yeah.
100%. 100%. It's just like anything else. I mean, if you go to a chiropractor, why are you going? Well, he's going because his neck hurts, and she's going because her low back hurts. So, you've got to know the case before you derive or arrive at a solution or a potential solution.
Exactly. And how can you make correlations with anything if you don't know, like you say, the history, what's going on specifically? And again, a lot of doctors always like to tell me when I say, what's a normal situation? They say, JJ, don't use the word normal because it's specific to every single person. And so, yeah, I like what you're doing there and saying, listen, we had to go in specifically for this particular patient, understand as much as we could, make correlations, start there, and not just assume, the same thing I've done previously will work with this particular person. Yeah.
Absolutely, 100%. I mean, that's
Yeah.
called good work. And so there are
I
some
wish there were more of it.
yeah, right. There's a lot of acupuncturists that do this good work, and there are a lot that don't. And that's look, I'm gonna share a pet peeve with you about something that's good for the public to hear. There's a company, I won't I can mention their name, well, there's no problem. It's ZocDoc. So
Okay.
ZocDoc is a huge company where you can go there and find healthcare practitioners, and they're always soliciting me. They want me to sign up with them. And so I went to their website, and they have a listing of acupuncturists. And I said to them, "I'm not interested. I don't wanna join." And they're like, "Why not?" Well, why not? All those acupuncturists that are in your list, they're treating pain. I don't treat pain. I haven't touched a neck or a back in 20 years. I said, "If you make a listing for fertility acupuncturists, I'm in." And so one of the problems with the world of acupuncture or complementary medicine is that to date, there's no specialization. So when you're an acupuncturist, by law, you can treat anything. You can treat chest pain, you can treat infertility cases, you can treat pain cases, but there's no way that one person can know enough about every type of pathology to be good at any type of pathology. So I'm always kind of pushing. I mean, I'm not involved in the world of acupuncture on a political basis. I don't have the time or the desire. But, on an emotional, intellectual level, I would like to see specialization occur, just like in Western medicine. He's a cardiologist, she's a reproductive endocrinologist. I tell patients that I'm a fertility acupuncturist. I mean, I made that up, but I think it's completely appropriate to use.
Yeah, you have to be specific because it's way too broad, right? To say, oh, yeah, I'm an acupuncture. And I think a lot of us think, great, acupuncturist, done. But I think that's way too broad of a stroke to paint it with. And there are specific disciplines within that, as you're saying, fertility acupuncture and going through the different verticals, if you will. And so that's a great place to start to remind people of that because you don't want to be just lumped in a general category that is way too broad, right?
Absolutely, absolutely. And there's another thing that has a negative result because of this, which is that if patients don't experience success, of course, listen, not every patient experiences success with me, but I mean, if they're not experiencing success frequently, it may not be because acupuncture doesn't work. It may be because the acupuncturist doesn't know what they're doing. And I always say, and this irritates me, to a certain way, you'll never find ever anywhere in this world a reproductive endocrinologist that doesn't know what he or she is doing. There are better ones and less good ones, just like in any other field, but every one of them knows what AMH is. Every one of them knows how to do a retrieval. Every one of them knows the proper amount of gonadotropins to give to a patient. You cannot say that about acupuncture. So it's quite unfortunate in this field the way it's currently presented or
Yeah.
manifested.
Yeah, and again, we talk a lot about levels to everything, and I think people have to understand that there are levels to everything. There are levels to athletes, there are levels to doctors, there are levels to politician. At every level, certain people are just better than others. They've had more information, they've had better success rate, they have more evidence, whatever that looks like, more success. But I think you can't just lump everybody together. I've gone to good doctors, I've gone to bad doctors, I've gone to good acupuncturists, I've gone to bad. So that's a narrative that we have to try to find a way to overcome. And I think what you're talking about is a great one. Make sure that we really break it down. Let's make sure we understand, that there's no one solution for everything. Just as we say with any type of medicine, do your homework, do your research, find the right doctor, find the right person so that, you can get to the point you need to be, right?
Percent. If I may, I just want to give one tip to the listeners. When you're considering going to an acupuncturist for fertility reasons, go to the acupuncturist website. And if you see, which is often the case, a list from A to Z saying this is what we treat, turn around and run as fast as you can away from that clinic. That's
Great point.
you know, uh,
Great point.
you find a specialist.
Yeah. I say it all the time. Honestly, Mike, I say it all the time. When I go to a restaurant, and this is not anywhere in the same kind of comparison, but just understanding what you're saying. If I go to a restaurant, open a menu, and there are 1,000 items on the menu, I know they're not making every single one of those specific for me for that particular meal. It's very hard to do. I really trust and love restaurants where I go and there's like 7 items. They do them really well and they're fresh every time. And again, comparing that a little bit to this in the sense of, yeah, if I go somewhere and I see up on the wall, there's 42 different types of acupuncture, I'm thinking, how can they be a specialist in every single one of those? Or are they really just kind of a generalist and I need to go someone who has a lot more specific training with the one thing that I'm looking for?
Yeah, I think your food analogy, your menu analogy is perfect. I think it's real, seriously, I think it's accurate, it's real, and so, yeah, that's an important point that patients should know.
Yeah. Let's talk about the low level light therapy. I don't know much about it. I see a lot, online about red light therapy and all these different sort of light therapy, but maybe educate us on what low level light therapy is, what it does, how it supports what you're doing. I'm very curious about that.
Yeah. So, low-level light therapy is, again, one of these things that can be efficacious in improving fertility outcomes, and I'll tell you about it specifically in a minute, but just to go backwards for a second, it's that story again of using everything to help you get pregnant that makes sense. I wouldn't suggest taking an amethyst crystal and putting it in your belly button and hanging upside down and chanting a mantra. That's not gonna help you, I don't think. Um, and so I think low level light therapy is, uh, efficacious. It's not the be all and end all, but nothing's the be all and end all. It's all about putting all these things together. It's interesting, and this is a case where 1 + 1 = 5. You add different modalities, but you'll get potentially a very good outcome. So more specifically about low level light therapy. Low level light therapy was used for years to help mostly women, I guess, because I think it's mostly women that do facials. I'm sure some men get facials. I would like to get a facial, but I can't because of this beard. But the low-level light therapy they would put over your face, and it would, I don't know what it would do, but it had something to do with improving your skin quality, et cetera, et cetera. And what they discovered was, so let's talk about oocytes, eggs, which reside in follicles, which reside in the ovaries. These eggs, just like every other tissue or cell in the body, have energy and need energy. Where does this energy come from? It comes from something called mitochondria. And so eventually, when we grow old and die, I've thought about this, though I have come to no conclusion. Perhaps I'm not knowledgeable or educated enough to be able to understand this. But if my fantasy, my thought was, if somebody dies, even from an illness, from cancer, or whatever, it may be, let me restate, when somebody dies due to old age, my fantasy was, or my idea was, maybe their heart, their lungs, their liver, everything is just out of mitochondria. Just the mitochondria is gone. Just it depletes and diminishes over time, and you're dead because you have no more energy. I'm not saying that's the case. I'm saying these are the thoughts that I had. I said, wow, it's very interesting. I wonder if old age is actually translatable into a significant deficiency of overall mitochondria, cardiac mitochondria, brain mitochondrial function, et cetera, et cetera. So getting back to fertility, the eggs need energy to develop and to develop healthfully. And so mitochondria is the source of energy. So low-level light therapy has been shown to improve mitochondrial function or mitochondrial capacity in oocytes. Now, again, this is not world-shaking, earth-shattering news that's saying to a prospective patient, do this and you'll get pregnant. But what I can say with some amount of emphasis is do this and you're on your way, or you're using this as a contributing factor to getting better eggs. And in order to get a better embryo, you need a better egg. And so using low-level light therapy uh, has the potential to improve egg quality.
Yeah, it makes sense. And Even though in a way it's almost indirectly, right, doing it because of the effects that it has on the mitochondria, which then has a knock-on effect from there. Is that what I'm hearing?
Absolutely. You're right. I mean, it affects the mitochondria, and then the mitochondria then translates into, better oocyte quality, better egg quality.
Okay. So that's the connection. Yeah, I don't think we would know that, obviously, a lot of us. So I think that's great insight there. So let's talk a little bit about evidence and patient impact, because I love kind of this area to try to drill down a little bit further. Research shows, and you've already talked about it here today, acupuncture can support IVF outcomes, by promoting better blood flow, hormonal balance, and stress reduction, which I think a lot of us knew about the stress reduction part. But in addition to some of the points you've already made, how have you seen this play out with your own patient outcomes? Any other areas that you could kind of point to, which might also give us more clarity on this?
Yeah, absolutely. So what I'd like to do, if it's okay with you, is to start talking about stress reduction first.
Good. Let's
So
do it.
uh, everybody in the world that you will speak to, many people in the world, will tell you that stress has a negative impact on fertility outcomes. I'm not sure that's true. I'm not sure it's not true, but I'm absolutely not sure that it's true. Here's the proof. Here's the evidence. Go to Ukraine. Go to the Gaza Strip. Go to Vietnam. Go to Russia. Go to France in World War II. Uh, go to any war zone in the history of mankind. And what you will see is newborn babies and little kids running around all over the place. And so women have been giving birth for centuries in war-torn areas. I've not been in war, thank God, but I don't think there's any greater stressor than being in war. And so even in war, women get pregnant and have babies. Now, having said that, I will say this, perhaps in some patients, stress is a contributory factor. Stress can raise cortisol levels. This is a stress hormone, and that perhaps can negatively impact fertility. But it's really iffy. It's really iffy to me. I'm not sure that stress has a direct relationship on fertility outcomes. I think patients that are having fertility issues are stressed. And so perhaps using acupuncture and or psychotherapy and or Western medication, antidepressants, anxiolytics that are safe to take. Any of these things will be of utility because who the heck wants to walk around being in a high state of stress? But really, from the fertility perspective, I don't put too much credence on stress equaling infertility. I think infertility causes stress. I don't think stress so much causes infertility. So I want to put that out there. And yeah, we were talking about integrating acupuncture with IVF. Is that what we were talking?
Hmm.
So,
Yep.
well, yeah. So that's a very interesting point. I guess the question is, what is the benefit, or is there a benefit of integrating acupuncture and or herbs in the IVF protocol? Is there benefit or not? And yeah, I think there's benefit, and I'll tell you why. And again, I want to make perfectly clear, some of my best friends are reproductive endocrinologists. I believe in IVF. I'm a total IVF supporter. So I'm not knocking IVF and I'm not knocking REs, reproductive endocrinologists. But this is what I'm saying. At the end of the day, I'm going to describe IVF to you. This is what IVF is at the end of the day. You take medication to facilitate the development of a lot of follicles. The follicles contain eggs. You put a tool in there, a catheter, and you retrieve the eggs. You either fertilize the eggs with sperm in a petri dish, or you fertilize the eggs with something called ICSI, which is intracytoplasmic sperm, in intracytoplasmic sperm injection. And they just literally take a syringe and puncture the egg and put the sperm in there, and now you have a fertilized egg. And then they hope that it grows to a blastocyst. They hope that it tests negative, and they transfer it, and everybody goes, like this. So even though IVF has produced more than 4 million babies, it's really, and again, to the listeners, please don't misunderstand. I support IVF, but it's like changing a car tire. Anybody can do an IVF, with some training. What do you have to do? You got to give the medicine, retrieve, fertilize, and transfer. That's it. There's nothing in IVF, nothing that does anything about egg quality, that does anything about sperm quality whatsoever. The reproductive endocrinologist works with what is presented to them. That means they work with what the patient presents to them. The patient is 44 years old. She has diminished ovarian reserve and poor egg quality, but they can get eggs out. Her chances are not so great because her egg quality is not good. So this is IVF. You could say, well, IVF has a 35 to 50 to 49% success rate, depending upon which population you're treating. And then again, what does success mean? Is success pregnancy or is success a take-home baby? So it becomes more complicated. But why isn't it 100% reliable? Why isn't it 90% effective? Why? Here's why. Because some of your patients have bad quality eggs and bad quality sperm. So to utilize acupuncture and herbal medicine and low-level light therapy and change your diet and change your lifestyle have the potential to improve your egg quality and improve your sperm quality. Now, you still may need IVF, but this will take your chances of X and change it to X plus 10. So this is why it makes sense for the patient struggling with fertility challenges to absolutely include acupuncture and IVF and lifestyle changes into their protocol. It can't hurt. It can only help.
Yeah, that's very interesting because for me, now I'm hearing that they can work together a little bit, right? In the
Oh, yeah.
sense of, what you're talking about is that's almost like a proactive approach before you get to that point, right? Of getting to that IVF doctor. And that's a procedural part that then they can take care of, but they can cohabitate, right? It can be a collaborative situation, if you will.
It should be. Look, what I said 15 years ago was this. The new standard in reproductive medicine should be this. East meets West in reproductive medicine. That should be the gold standard. Every reproductive endocrinology center should have a qualified acupuncturist and herbalist on staff working with the patients before the patient does a retrieval. This should be part and parcel of the medicine. And there are many reasons why this is not the case. One of the reasons, in my opinion, and I'm considered to some people to be a fairly controversial guy, and I suppose in some respects I am, and so I'm going to be controversial now. These doctors that I know, they're fantastic people, they're fantastic doctors, but there's a lot of ego. Listen, they don't want the acupuncture and the herbs. They want to claim I'm responsible for you having that baby. This is a bad, bad thing. It takes a village, man. It takes a team. There should be no ego here. But that's kind of like saying there should be no violence in the world. It's never going to happen where there's a reduction of ego such that this concept will be promoted and utilized. But if I had a bunch of money and I was going to open an IVF center in New York City, this is how the IVF center would look. I'd have the best reproductive endocrinologists. I'd have a big room set up for yoga and meditation. I'd have another big room set up for group therapy or individual therapy. I'd have a couple of rooms for acupuncture and herbal medicine. Listen, there's a reproductive endocrinologist whose name I'll mention. Why not, right? Dr. Robert Kiltz, Kiltz. He's a pretty well-known guy on the East Coast. He's got probably 4 or 5 clinics, and he's a super interesting guy. He's a total reproductive endocrinologist, like just like any other RE. This guy, I went to visit him upstate, and I'm in the clinic. He's showing me the clinic, and it's winter. It's cold out. There's snow on the ground. He says, "Come on, I want to show you something outside." And I'm like, "Rob, do we have to go out? I'm freezing, man." And he says, "Come on, man up." put a coat on and let's go. I'm going to take you somewhere. So we exit the clinic and we walk not far. We walk like, 100 feet, and there's a building there. And I'm like, "What the heck is this? What's this?" He says, "You're going to see what this is." So he takes me into the building, opens the door, we walk in, and it's got like 15 tables, beautiful drapery on the tables, linens and all this, and beautiful artwork. And you know what this was? It was an acupuncture center for his fertility patients. And he is the first guy to say, use acupuncture, use herbs. This stuff is good. This stuff is legitimate. This is a reproductive endocrinologist. And so there are some of them that are like that. And there are many of them who are not. And the ones who are not are making a big mistake because they are not God. They cannot guarantee positive outcomes, nor can I. But if you take reproductive medicine and you integrate it with traditional Chinese medicine or complementary medicine, I assure you, you'll have better outcomes in the long term.
Love it. I mean, that's amazing that he's doing that. Robert Kiltz, you said, right?
Robert Kiltz,
Love that.
Kiltz.
Amazing. And obviously, when you go and talk to, reproductive and endocrinologists and you're saying, hey, listen, I'd like to collaborate with you. They're not going to say, well, actually, Mike, I'm a pretty arrogant guy and I am God. They're not going to say that. So I'm curious, what excuses are they telling you when you want to collaborate with them? What do they normally say, or what does that look like?
So there's a couple of situations. I have relationships with some reproductive endocrinologists who are terrific, intelligent people and understand the greater picture. And they send patients to me and I send patients to them. And, we love working together. Uh, there's a center in New York, Ferny, Ferny. Um, Great doctor, Stephen Samkuti, reproductive endocrinologist for 25 years. He's a professor of reproductive medicine. He's a professor of gynecology. He's been involved in 150 studies, high level human being, most humble, down to earth, delightful guy. Totally believes in acupuncture and herbs and sends me patients all the time, as I do with him. So you have REs that are like that. And then you have REs who will always be nice and respectful and say, thank you very much. I appreciate it. Give me some of your cards, and you'll never hear from them again. And so, I don't know why. I don't really care. I think I care in the sense that I think it would be of better utility for the patient. You see, I care about the patient. I don't care about you, doctor, that you believe this or you don't believe that. Get off your high horse, do some reading, learn about this, and understand, as does Robert Kiltz, as does Stephen Samkuti, that there's some potential benefit here.
Yeah. And a lot of
So,
them, I think, don't know that much about it, honestly. They haven't read, they don't understand it. And what's the quick response to that? To make a flippant response and kind of dismiss it, to say, no, no, this is what you need to do. And the ones that will collaborate with you, obviously, they've taken the time to understand it, to learn about its benefits, maybe as a preparatory situation before they go into the IVF with them, as Dr. Kiltz is doing. Yeah, so much of this is levels to doctors, like we always say. Agreed.
absolutely. And the other thing is when you're going to medical school, when you're going to acupuncture school, you learn what you're taught. That's it. So, for example, if doctors who were going to medical school and doing a fellowship in reproductive endocrinology were given a couple of classes, not to teach them acupuncture or to teach them herbal medicine, but to teach them about it, how does it work? What kind of positive effect can it have on patients? Then maybe there would be more REs, buying into this kind of complementary protocol.
Yeah. What do you think it's going to take to, as I'm listening to you here today, what do you think it's going to take for in the world of medicine and when people are getting educated? Because we have to start at an earlier age, right? When they're in medical school or even earlier than that, what's it going to take for them to say, hey, listen, in this area, if you're studying IVF, we need to also look at acupuncture, as you've talked about today, prior to that, because of these amazing things that it does. What's it going to take to get people to change, or maybe they're already doing it? What do you think?
Yeah, it's a good question. I mean, I don't know the answer. I'll just give you another idea, and then I'll jump back more specifically to your question. In medical school, doctors are never taught anything about nutrition.
True. I've heard that.
Yeah.
Yep.
So, how damn stupid is that? I'm not expecting a reproductive endocrinologist to be a nutritionist. That's another 2 years of study. But listen, you've got to know that if a patient is eating too much of this or not enough of that, it has an effect on their body. So I think there's a saying in Spanish, saber es poder, which means knowledge is power. So I think, it has to start in school. And your question was very direct. Your question was, what's it going to take to facilitate this change? And I don't know what it's going to take. Perhaps this is something that must be driven by patients. Patients must go to the doctors and say, listen, I want to include acupuncture and herbal medicine in my protocol. And let me talk a little bit more, if I may, about herbs. I've heard doctors say, and not many of them, thank goodness, but don't take herbs. It can screw up the whole thing, and they can be dangerous. This is the biggest crock of nonsense. You're saying that herbs can be dangerous? No, herbs cannot be dangerous. IVF can be dangerous. IVF can cause hyperstimulation syndrome. This is a life-threatening disorder. I'm going to tell you a story. I sat in. No, I'm sorry. It's a different story. I didn't sit in, but this story that I'm going to tell you is true. I heard about this about 12 or 13 years ago. Thank God for the patient that this reproductive endocrinology center, this reproductive medicine center, was actually in a hospital setting. So listen to this. The doctor is about to do a retrieval. The head of the femur, there's the femoral artery, and the head of the femur is a round structure, unlike an ovary, which is more of a, it's not exactly round, it's more oval.
Mm.
But this doctor punctured the head of the femur, thinking it was an ovary. So let me tell you the bottom line. The bottom line is, if they didn't get that patient upstairs to the ER and get her right in, within about 7 minutes, she would have been dead. Does this happen frequently? No. But listen, I want everybody listening to get on Google and to type in how many deaths or serious illnesses occurred in 2024 as a result of taking herbal medicine prescribed by a board-certified herbalist. And I'm going to tell you the answer. That's the answer. That's what they're going to find. Now, can herbs be dangerous? Yes, they can. You have to know what you're doing. But listen, is brain surgery dangerous? Of course. But if you have a a tumor that's growing in your pituitary gland and bromocriptine is not shrinking it, you're going to need a brain surgery. Because if you don't have the surgery, guess what? You're going to die. Now, is brain surgery dangerous? Yes, it is. But what would you do? Would you go for the surgery or not? I would. So everything is dangerous. It's dangerous walking out in the street. You have to look both ways before you cross. Herbs are totally safe if they're utilized or prescribed by a board-certified herbalist who knows how to write prescriptions. If you go to an herbalist that just gives you pills, it's not dangerous, but it's not efficacious.
Yeah, totally. Because again, it's always about, probabilities. There's a lot of danger in anything, but if I have a probability that this can also help, and I think what you're talking about for me as a patient, we talk about a lot of this on DocStars and on various shows within DocPod, which is as patients, we have to advocate for ourselves, right? We have to make sure we understand the situation. We have to make sure we have the right doctor. And if not, go to a different doctor, but go to 2 or 3 doctors, get second or third opinions. So we always want to stress it's so important, I think, for all of us to really advocate for ourselves as much as possible, right?
Yes, absolutely, 100%. 100%.
Yeah.
Yeah.
Let's talk a little bit about vision and education because, one of the things we're trying to do on DocPod is when someone just Googles something that they just don't take it right off, exactly what it says. Do your research, as we just said. There are levels to everything. So if someone searches, for example, best holistic fertility support or fertility acupuncture near me, From your point of view, what are the key practices and philosophies, you want them to discover about your work when they're doing these types of searches? If you're only leaving them with a couple of key things to remember, what would that look like?
Well, look, as I said earlier, rather than initially respond with what you should be looking for, I'm going to talk about what you shouldn't be looking for. So if you best acupuncture for fertility enhancement near me, and yin and yang acupuncture pops up, and you go on their website, and it says there's all these links about our back pain and neck pain and how we've successfully treated migraine headaches and we've had good fertility outcomes. Don't go to that practitioner. You need to find a practitioner when you get to their website that either all they do is treat fertility, or maybe they treat fertility and some gynecological issues. They treat pelvic pain, they treat these kinds of things. But you want to find somebody whose life and whose practice is devoted to treating fertility cases. There's a website, and if it's okay with you, I'd like to mention the
Of
website and
course.
tell the
Yeah.
viewers what it is. So first, I'll give you the website. It's aborm.org. And that website will take you to the American Board of Oriental Reproductive Medicine. And the acupuncturists that belong to this board know their stuff. I'm going to tell you a quick story. I'm a New Yorker. I live here, and I was invited to join this organization many, many years ago, and I was interested in doing so. But in order to join, you had to take a test. And I flew out. I don't remember where it was. It was either Vancouver or Chicago. I can't remember. But I had to get on a plane, man, and travel somewhere to take this damn test. Did I study for the test? Of course not. I know everything. I mean, I don't mean that I know everything. I mean, I know a lot. I don't need to sit and study for any. I mean, I study all the time, but for a test like this, I don't need to study. So I fly out there and I get this test in front of me, and I'm like, holy crap, this is really difficult stuff. And a lot of the answers I didn't know. And I have to tell you that I barely passed the test, but I was thrilled that I barely passed the test. I might have been more thrilled if I failed it, because it said to me that the practitioners that join this organization are indeed legitimate. So I would say to patients, go to aborm.org. You can put in your zip code, and acupuncturists that belong to that organization will populate in your zip code. Obviously, not every zip code has a member of the ABORM living or working there, but it's a very good place to start. Now, here's another thing. When a patient calls an acupuncturist, let's say not from ABORM, just from, they found them on Google, they found her on Google, the patient should talk to the practitioner, and they should say something like, my AMH is 0.1 or 0.9, and the other thing I want to tell you is I'm growing a little hair under my chin here, and I've got some acne, and I have pain with intercourse. What do you think this is all about? You're on the phone, and if the person they can't answer any of that, you got to hang up the phone. Oh, and here's one
Interesting.
more thing that I want to say, which I believe in to my guts, man, to my soul, to my heart. An acupuncturist, and I'm only going to talk about fertility acupuncturists, but it really holds true to every acupuncturist. If you're treating fertility, it is absolutely essential that you learn Western reproductive medicine. Now, do I know as much about Western reproductive medicine as a reproductive endocrinologist? Absolutely not. But I know enough that I can interview a patient, and I do this every day, and say, you know what, you need to get tested for this, this, and that. Your doctor hasn't tested it. And the doctors will call me up and say, you're the acupuncturist. And I'm like, listen, calm down. I don't care that you're the doctor. Do your job. These are the symptoms of this patient. You need to test for this malady. I'll give you an example. A very straightforward example. Same thing. I'm doing an intake on a patient. And I'm saying, listen, you're vaginally lubricated. You're going to have sex. You're lying on your back and your husband penetrates you. Do you have pain? Yes, I do. Well, is he super large or is he average in size? No, he's average. Okay, you have pain all the time when you have sex? Yes, I do. And what about your period when you menstruate? Oh my God. No, 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 don't say oh my God. From 0 to 10, what's the pain? It's a 12. I know damn well this patient has endometriosis. So I will write a note to the doctor and I will say, do a Receptiva DX test, which is a uterine biopsy to look for a molecule called BCL6. And if BCL6 exists, she has endometriosis. Now, what are you going to do about it? You don't need to have a surgery. You needed surgery 15 years ago. All you need is to pop a few pills. It won't cure the endo, but it'll suppress it. And now you can have a baby. Men, listen to this. I get patients and I say, how old is your husband? Oh, he's 45 years old. Did he have a semen analysis? Absolutely perfect. And let me take a look at the semen analysis. So I'm looking at it. This is me, the acupuncturist, looking at the semen analysis. And I'm looking at the concentration, the volume, the motility, the morphology. And it's all great. And I say, here's a prescription for your husband. I want him to go to this laboratory and get a test for sperm DNA fragmentation. What's that? Well, the sperm has something called chromatin around the middle of the body, the tail of the sperm, the middle, the midpiece of the sperm. And in that chromatin is the DNA. And if that DNA fragments, two things happen. Number one, it can't penetrate the egg. REs will say it doesn't matter. We don't need it to penetrate the egg because we'll do ICSI. On the other hand, yes, you're doing ICSI and you're putting a bad sperm, a fragmented sperm in the egg. And now you expect to get a good embryo. Now, sometimes, in fact, you can get a good embryo because a very good quality egg can repair the DNA fragmentation in the sperm. But if the egg quality is not so good, it won't repair it, and then you won't get pregnant. Very, very few doctors test for sperm DNA fragmentation. I always have them tested if they're above 38 years old. There are so many things that don't happen that on the Western medicine side, that because of my knowledge of Western medicine, I can facilitate. So I just say to the acupuncturists that are listening, if you want to do good work in reproductive medicine, learn reproductive medicine, buy some books, take some classes. This is key. You can't just be an acupuncturist and an herbalist and treat that. It's fertility is the most incredibly complicated issue. And you don't know anything about it in Western medical terms. You got to run like heck from that acupuncturist.
Yeah. And I think it'd be great when I hear what you're talking about there, which is listen, if I'm working in IVF, maybe I should just at least, I shouldn't be a specialist in acupuncture, but maybe just have a core competency, maybe have an idea, the correlations, how these things go together, and vice versa, right? So I wish more of that was going on from either side, right?
Me too. I fully agree with you. That's absolutely the way it should be. And that
Makes total sense.
will help the patients.
Well, agree. And it makes total sense for me. Okay, so where do you see, if we're looking ahead a little bit, because we talked a lot today about what's been going on, but if you're looking ahead and you're saying, okay, where do we see fertility medicine heading in the next 5, 10 years, something like that? Whether it's through either new technologies, evolving herbal approaches, right, which might be fluid and changing, or even shifts in policy. What do you think that looks like moving forward? What are your thoughts?
Yeah, it's a great question. I'm not sure I have a great answer. I think for one, AI is going to make a big difference across all fields of medicine. AI is going to be an incredible tool for diagnostics. It's going to be an incredible tool for prescribing medications, for prescribing correct dosages or the best dosages. So I think AI is going to be it probably already is, but as time goes on, it's going to facilitate great change in medicine. Um, I think the study of genetics is going to change the face of of reproductive medicine. I think there's going to be medicine that are going to affect gene function, and as opposed to cellular medicine, cellular based medicine. So I think that as time goes on, medicine will improve. Um, there's not going to be any advances in acupuncture and herbal medicine because it is what it is. The advancement in the medicine comes from the practitioner becoming more advanced.
Makes total
Um,
sense.
yeah, the medicine is what it is. There's not going to be like 100 years from now, acupuncture is not going to be any different than it is now. But it's just about the practitioner being the best that he or she can be. But as far as Western medicine, I do think AI and gene therapy is going to be a big game changer.
Yeah. And just convincing, other doctors to use it. I always say you need to be open to it. Like you say, the medicine or the stuff that you're talking about in terms of acupuncture and herbal medicine, it is what it is. It's been around for a couple thousand years, maybe longer, right? So it's there, but maybe AI will at least open the door to current physicians and doctors to say, hey, listen, maybe it's going to tell me more about that. Maybe I should be open to this because, again, more correlations can be made between all of these. Right now, I feel like it's here and it's here. But if it brings those two together, then I think it's a win, right?
I absolutely agree with you. And look, maybe this will change and maybe it won't. I think, as you stated earlier, I believe you said something like 40% of patients are now utilizing acupuncture as part of their protocol. Back when I started, I mean, I don't know the percentages. I don't have that data, but I can assure you it was less than it is now, and perhaps in the future it will be more than it is now. I think as patients become more aware of the benefits of the utilization of acupuncture and herbal medicine in the context of fertility enhancement, they'll be more apt to jump on board.
Yeah, couldn't be further, for me. You're right on it. I mean, exactly what it is. And I think that is such a big part of this. So, Mike Berkley, amazing. The Berkeley Center in New York City. Thank you for sharing your journey. It's been great today. A lot of stuff we talked about. I love your passion, obviously, and
Thank
also
you
your
so
vision
much.
with us today. And I want to mention, from acupuncture and herbal medicine to low level light therapy, which we talked about earlier, your story for me shows the resilience, also the science, right? The compassion and how you can transform fertility journey for patients everywhere. So again, love it. The work you're doing is giving couples renewed hope, which is fantastic. We always talk about that, improving outcomes, changing the way reproductive care is delivered. So again, we appreciate your dedication and bringing holistic care, of course, with modern fertility medicine's amazing. So thank you for joining us on DocStars. It's been great.
I just want to say I'm thrilled to have been a guest on your show. Thank you for your generosity in having me here. It's been wonderful. You've been great. Thank you so much.
We love it, Mike. Again, it's just about starting the narrative as much as we can and making sure people hear about this. I feel like so much of it is there are always bad actors in every area, but I feel like what we've talked about today hasn't been put on the table enough. So, yeah, again, thank you for joining us on that. Before we go, I would like to leave everyone with our key takeaway from today's discussion. Every show we have it, it's called the clear signal. Infertility isn't just a medical challenge, it's an emotional and it's a human one. So, what Mike Berkley and the Berkeley Center in New York City are proving is that integrative medicine can fill the gaps that conventional care leaves behind. We want to get those two collaborating. This can give patients renewed hope, better outcomes, and a pathway to healing that's scientific and compassionate. So a special thank you again to Mike Berkley and the Berkeley Center in New York City. Please like and subscribe so we can continue bringing you conversations with top doctors and healthcare leaders like Mike Berkley from around the world. And as always, follow the DocPod channel. Follow us at #DocPodHealth, at DocPodHealth, because health, it's everything.
Celebrating the world's best. This is DocPod's DocStars.